Yeah, so today, Dr. Liu, what I'd like to do is introduce you as a speaker to Inspiration by Integration 2024. You're a sleep surgeon, so do you want to share a little bit more about your work?
Thank you, Shireen, and really happy that Inspiration by Integration will happen again. We had such a wonderful run back in 2020 on Valentine's Day, actually, and really looking forward to this rendition. I guess sleep surgeon is a funny term because very few people know what we do, and truthfully, we're just kind of training now a new generation of sleep surgeons. I think it's an era where sleep surgery is a functional oriented surgery. That's the goal, meaning restoring anatomy is maybe a part, but really it's about restoring function. And here we're mainly talking about breathing, right, during sleep, and all the wellness and medical, dental, all the factors that it can influence. So really, my job is just to optimize the airway from our pediatric patients to adult patients, to make airway issues during sleep, to minimize it, to really minimize it. And the main goal really is so that during wakefulness, right, everybody can realize their potential because they had a good night's sleep. Now, should qualify that by treating sleep disorder breathing, it does not guarantee better sleep. And again, this is why Inspiration by Integration is very important, because we still need to have all the different experts involved to try to restore good sleep.
Yeah, and I should just explain as well, you're the one that came up with the term Inspiration by Integration. So I love that. I've taken it again to use as well. And in terms of the actual surgery that you performed, you're really trained in maxillofacial surgery. You offer the full scope of ENT surgeries as well as the upper airway stimulation. And I encourage people to read your bio on the webpage to find out a little bit more about your accomplishments. So I know one of your core values is really restoring airway health as a gateway to wellness. So can you really explain a little bit more about that? I feel very aligned with it, but what does it mean to you?
Yeah, I think about that on a developmental model. If we think about restoring airway health during sleep for children,
Mm-hmm.
and we are, we're contributing to, significantly to the quality of their sleep. And if we think about other very common problems that kids, deal with, let's say, anatomically with, malocclusion, a lot of, orthodontic dental treatments, perhaps, and then, mood wise or, school activities wise, the restlessness, the, just, even bedwetting, when the kid is still is already like 7 or 8 years old. There's so much there. So again, restoring airway health for them is absolutely related to wellness for them at that stage of life. But it applies to the young adult. It applies to the young adult where there's a lot of comorbid anxiety and depression. It applies to the middle-aged adult where there is a lot of, metabolic syndrome and cardiovascular related issues, and not to say the loss of productivity. So if we kind of look at all of that, at least, where I can contribute well, as a surgeon, really is to promote the best airway health someone can have, to contribute towards a good night's sleep. And that, again, impacts so much of what we do during wakefulness.
Mm-hmm. Yeah, I mean, really, my interest in children's airway began with treating the adults, like you said, with the depression, the anxiety, and really seeing that this is actually an issue that is quite modifiable very early on in life. And it's why I'm super passionate about your work. Seeing your work is really what brought me to treat younger and younger. I think the evidence that the research that you've done on the adults protocols and everything, it just makes sense to do early intervention. So, I mean, last year or 2022, they had the ADA Children's Airway Conference, and I asked that you be part of that as well. Really loved your talk, and the participants really enjoyed that as well. So can you share a little bit more about what you think you can bring to the program for children when a lot of your work in the past has largely been around adults?
Yeah. You know, it's so interesting just to think about the field that, you know, if you go back, you know, the first person that really promoted the idea that children have sleep disorder breathing, obstructive sleep apnea, and that's, you know, Professor Christian Guilleminault, right, affectionately known as CG, who wrote that first paper, right? I think it was like the first 8 or 9 kids with sleep apnea. So you know, if you think about it, and this wasn't that long ago, right? This is in the early 1980s. Like he had to do so much work just to prove to people that kids have sleep apnea, sleep disorder breathing, and upon treatment, they'll do really well.
Mhm.
And it's not just measuring an AHI. It's about he had like outcome measures of school performance, right? And you know all the you know weight gain, weight loss. I mean, there's so many cool things that kind of characterize an overall state of being much more accurately. So okay, I think now we're in the era where folks may recognize kids can have sleep disorder breathing. It's not just about tonsils. It's not just about maxillary expansion. I mean, it's so much more. And I think that's what this course is going to bring about, which is beyond that, beyond what we already kind of know. How how does a team approach, you know, make this treatment, you know, effective? One of the biggest problems with treating chronic conditions like sleep disorder breathing is that we as clinicians we see these patients that you know one snapshot at a time, right? We see them at one cross section at a time, but this is something they struggle with every day. And so that's why this developmental process is so useful. When I see an adult with issues, when I examine the anatomy, when I look at the physiology, you know, it's about looking, you know, guessing. So what brought you here? You know, what led you here? One of the cases I really like to show, you know, a young child with asymmetric nasal obstruction and then leading to maxillary cant and facial asymmetry. And probably for a long time, people just treat facial asymmetry. A person walks in, the face is asymmetric, we're treating facial asymmetry. But if you knowing how it led to that, or at least knowing what you know contributed significantly to that, makes me think that you know when you have that 8-year-old, 7-year-old treat nasal breathing because we don't want to deal with facial asymmetry, you know, and everything else afterwards. And so, kind of looking back, right, that developmental process, I think is super critical. The other insight, of course, in treating adults, you know, when we look at sleep MRI research that we have done, you know, looking at adult anatomy and those who have severe sleep apnea. And today, as you know, that we have so many tools that we can use. We could do skeletal surgery, soft tissue surgery, you know, neurostimulation, oral appliance, plus all of the above, you know, what have you. There's so much. You know, positional therapy if you don't want to do surgery, plus obviously we know the CPAP and the oral appliances. But I always say, you know, in the end, all we can treat is sleep apnea. And that's a problem because, you know, if patient comes at age 55, let's say we treat their sleep apnea effectively, but we are not able to reverse, right? The 55 years of poor breathing during sleep that leads to a lot of issues and you know the metabolic syndrome, the early cognitive damage, it's not reversible. So yeah, I you know yeah. Well, and one last point, if I may share too, is that's kind of taking insight from the adults and then trying to work backwards. But you know, looking at children, looking at development, also I think underpins the functional surgery I'm talking about. It's not vague at all. You know, we just today in clinic, you know, we're talking about, you know, surgeons doing multi-piece maxillas, right? So meaning when they're doing jaw surgery, because the upper jaw is narrow, so they cut it into multiple pieces. Isn't this not a problem, you know? But I always say, you know, the teeth go where they go, but the airway doesn't come with it. Now I'll go through these details in our meeting. But what's really interesting is if I have trouble ever convincing a surgeon to not do it that way, all I do is I ask them, hey, so let's say this patient isn't 50 and this patient is 10.
Mhm.
And what would you do? Oh, I would expand the maxilla. Aha, okay, so why do it this way, right? So don't create surgery, right? So I learned a lot from the kids as well. On the ENT front, it's the same thing. Kid comes in with big tonsils, what do? You remove them. Do you do funny, weird flaps to kind of like relocate their muscles and whatever in the throat? Of course not.
Mhm.
So probably shouldn't do that in adults either. So sleep is fascinating because there's already so much that gives us clues on how we can best restore anatomy and function. We don't want to create surgery. In fact, we just want to create the most minimally invasive surgery to restore form.
Mhm.
And then, of course, the breathing retraining and the brain retraining itself to catch up to the anatomy, that's a whole other discussion, which we'll have in the meeting. I'm looking forward to all your other experts there
Yeah.
as well. Yeah. So
I think
feel free
one
to
of the
cut and
things
edit everything I've said because it's a very long segment. But the
I'm
point
not going to
I'm
edit
trying to
actually, so
show,
we'll move on.
yeah,
But
the point I'm trying to show is it's
yeah,
very bidirectional.
yeah,
In
yeah.
you're observant of adults, you kind of think about how to treat other children, and then
Mhm.
when you look at growing individuals, you know how to restore the adults who are not growing anymore, and just not creating surgery. We're just trying to optimize form.
Yeah, and I think what's interesting is despite all the various surgeries that you can do, and MMA, double jaw advancement is promoted as the most effective surgery, what your work has really shown is that pellet expansion has a very central role to nearly everything we do in terms of restoring nasal breathing and tongue space. So what I want you to wrap up with is a lot of controversy in that orthodontic field. People are saying we should not be widening pellets in children as a vaccination against OSA. And, it's hard to know what to think for many people. But from your perspective as an adult sleep surgeon, what comments do you have to say regarding that?
Yeah, it's the academics and a lot of clinical I don't know progress, if you will, they often come at a cost of a lot of political strife. I mean, I'll tell you a fun story. Years ago, when my mentors Nelson Powell and Bob Riley, there was a cool article. I think it was in you know in Chest, with the pulmonary journals. Anyway, there's a debate. And the pulmonary physician writes, by the way, this is literally the title. So just look it up on PubMed. But the pulmonary physician says there is no room or no space or there's no need or no whatever for surgery in sleep apnea care. And then my mentor wrote, why surgery was important. There's not one field that's really going to be able to become expert in
Mhm.
this whole diversity of things that affect sleep and sleep effects, and so and today we know that there's so many things. I mean, it depends on how you look at it, right? When I say, if I do a little nasal surgery so that the patient can tolerate CPAP better, I mean, that's fine, right? There's a role for surgery there, or a little nasal surgery and a gentle pharyngoplasty, and then so the patient can wear an oral appliance better, or even today on the oral appliance plus Inspire.
Mhm.
You gotta. So that's why the central to our course, right? Inspiration by integration. This field is, we're not going to be able to help our patients unless we all pitch in our expertise. So going back to what you're saying, no, I don't think orthodontics is going to treat all of them.
Mhm.
But there's not one field here that's going to treat all of them. But orthodontics has such a central role in dental facial development,
Mhm.
that without them,
Mhm.
um, you're okay. Well, just let kids grow, and then they end up with me, and they have to do surgery and shoots. For me to do good surgery, I need orthodontic support.
Mhm.
So I think it's one of those things where the more we realize that this is an integrative process. I don't know. I often like to use the sports example, because we cut on bones, we cut on muscle. Every athlete knows it's
Mhm.
about the rehab. that happens afterwards. It's about the prehab. I like to use that term to prevent injury, right? Athletes who are more flexible may get hurt less. Now, once they get hurt, it's about the rehab. Do you need nutrition? Probably, right? Do you want the best, whatever equipment during your rehab process? I mean, all of those things factor in. Sleep is no different. Sleep is a function that we all want to optimize. And depending on at what age and what folks are doing, we just got to put the team together. But I think we're better now. I don't think any one field feels like they quote unquote own sleep. And the rest is academic politics, and it's always going to happen. But I'll end with this cool story. When CG passed away, it was very sudden, right? And there was no one to clear out the office. I was in clinic that day, and anyway, they were saying, well, look, if you're welcome to go through, his books or whatever, and because if you don't, they're gonna throw everything out that night. So folks go in, took some photos, some diplomas. Obviously, there's CG was the encyclopedia, of sleep, and I took a couple binders, and there was this very fascinating binder. And it was interesting because the binder was full of these dental studies on expansion, on, dental facial, orthopedics, if they want to talk, put it that way. And I was like, yeah, I mean, this is what we do now. Well, we're hoping folks, kind of see its value. Then you realize those things were collected in 1970. All right. So, it took how many years to get to this point? I mean, sharing your book, the stuff that you wrote about in your book. I mean, yes, you're trying to promote this. And hopefully we'll all do a good job promoting the importance of this and efficacy. But 1970, I think that was just a dream vision, that someone like CG had. He knew it wasn't all about CPAP. He knew it wasn't going to be all surgery. He knew in the 1970s that you just got to change the facial structures that matter with breathing. And anyway, so it's fascinating because he already saw it then, but it didn't happen right away. Right? I mean, come on, it took 50 years or more for us to get to this point.
Yeah.
So anyway.
Oh.
Yeah. Go ahead. Sorry.
No, you continue, Stanley.
Oh, no, sorry, please.
No, I was just going to say, when you mentioned the article to me, I told you I was already familiar with it because I'd heard about it through some conference, and that 1970s paper by Lindsay Gray is actually done in Perth. So I told you I'd met the orthodontist a couple of years ago who's aged 92 at the time. And he told me that they have expanded 2,000 children in the 70s in Perth, right here where I live. And it actually was so successful in helping them restore nasal breathing, and they noticed the improvements in children's concentration and attention. And they largely received medical referrals. It was very controversial in the orthodontic department. So when
I'll show you our conference side by side, that paper we're talking about and CG's first paper describing pediatric OSA. They're practically the same group of patients. Two papers only 1 year. Anyway, this is such a hugely fascinating field, and it's almost I don't know, peculiar how something that is so central to all of our existence, so central to all of our humanity, and we're just picking it up now, and really, anyway, so can't be more excited about the meeting. I hope. I think we built in a lot of chances for discussion, interaction. It's very, very valuable to bring all the pieces in.
Absolutely. So there are 6 speakers from different disciplines, but we have started to get other specialties joining: osteo, physio, speech. So it'll be a really great discussion, and really, you're one of my top people to work with. So I can't wait.
Huge fan of yours, and now you have your book, and so now we legitimately can be fans. Wait, and the participants, just bring your questions and raise them. And, remember last time, Sharon, when we did it, we were in the whole big room and there's some other experts in the audience, and they're like, oh, well, I do it this way and
Yeah.
this is how we can contribute. Awesome. So just bring your questions, open mind, and, it's going to be awesome.
Yeah. No, amazing. All right. Thanks so much. All right.
Yeah. All righty.